sometimes it's better for me to just sit back, bite my tongue, and then in 4 years I'll be able to say what I want.
There has been a gradual institutionalization of this code of conduct, the effect of which is to prevent people from ventilating their views. Bright students won't put up with it.
Buckley Fellows believe that all perspectives must be heard and examined in good faith.
They stand united against the formation of a liberal-only echo chamber at Yale.
We disagree, we debate, and then at the end of the day, we remain friends.
Welcome everyone to Pod and Man at Yale, the official podcast of the Buckley Institute. I'm your host, Ari Schaefer, Director of Communications at the Buckley Institute. Please subscribe to Pod and Man at Yale on the App Store, on Spotify, Amazon Music, or wherever you get your podcasts. And please, if you like what you hear, leave a review. If you don't, just complain on Twitter, I guess. This is the COVID episode with our esteemed panelists, Senior Isha Brahmbhatt, Noah Riley, also a senior, and Trevor MacKay, a junior. We're honored to have Dr. Scott Atlas as well, an important dissenting voice on the lockdowns and how this country handled COVID. So in true Buckley fashion, let's get right to it. On Friday afternoon, December 1st, the Buckley Institute is hosting its annual conference in New Haven. Join us for a day of all-star panels and top-tier speakers recognizing the 75th anniversary of Richard Weaver's Ideas Have Consequences. Get your tickets today at buckleyinstitute.com/conference. Today, we'll be discussing how COVID changed campus life. I'd like to first introduce our panelists for this week, Isha Brahmbhatt, a senior.
Hi.
Trevor MacKay, a junior.
Thanks for having me again.
Welcome back. And Noah Riley, a senior.
Great to be back.
So I want to first take a broad look, and then we'll kind of get into the nitty-gritty details of how Yale did. So this was your college experience, important part of your life, and a fairly good school. I'm sure you guys were all very excited to start at Yale. It was and still is altered considerably by the way Yale handled COVID. How do you guys think Yale did? Noah?
I mean, I think it sucked. Like, it was the worst semester of school that I've ever had, and I wish that I would have taken a gap year like Trevor did. It was just very suffocating. When we got to campus, we couldn't leave our residential college for 2 weeks. We couldn't even leave our dorm room for the first 36 to 48 hours before we got a negative test, and then from there it was just masking everywhere. It was just very impersonal and very regime-like.
Isha, how do you think Yale did?
I agree. It was really horrible to be there that first year. I don't think Yale did a good job at all. They didn't really seem to be caring about what students wanted and how they could make a better experience for everyone. It really made life very difficult that first year, both from a learning perspective and just making relationships and building community here.
What were the kind of things, Isha and Noah, when you started your freshman year in the midst of COVID, what were the kind of policies at Yale that really stood out to you, that really impacted your ability to learn?
I think one of the worst things was, from the perspective of community, was Yale's encouraging people to report others for COVID violations. So like Noah mentioned, it was a very strict masking policy everywhere you went, even while eating. In between bites, they wanted you to put your mask on. You couldn't have more than 6 people in a room, always being 6 feet apart, all those things. And they're obviously very difficult to comply with all the time. And Yale encouraged, in order to really make sure students were complying, encouraged students to report each other. And that created lots of fear, mistrust amongst each other, and made it very difficult to really be friends with anyone.
Noah, what were the policies that most impacted your ability to enjoy your freshman year at Yale?
Like Isha said, the incentivization of students to report each other was just wrong, I think. I had a friend in my college my first year who got sent home about 3/4 of the way through the semester because someone saw him not wearing a mask once, and they sent him back home to Spain, halfway across the world, right? They basically deported him. And it was just crazy. I think it really made it hard to build up the community when you're living under those guidelines against your fellow students.
So what did the request to report your fellow students look like? What were they telling you to do?
It was there were posters everywhere, see something, say something, right? Report them to the community of COVID compliance. And they would have to have a meeting, go over what punishments looked like, etc.
Trevor?
I mean, I think the best way to describe it would be Orwellian. It really was. Their propaganda posters that they put up around campus were really well designed, actually. Really good works of propaganda from the Yale press. But yeah, I mean, there was a hotline set up you could call to anonymously report your peers or anybody really who was in violation. They would have to go before essentially a tribunal to atone for their sins against the COVID regime. I think that it was very regimented, and as Noah, I think, described it, it was a regime. It was a COVID regime imposed by the Yale bureaucracy.
So I imagine having a setup like that in place, called a regime, call it what you will, would make it hard to make friends and to trust your fellow classmates if you're worried they're going to report on you. So going back to Noah and Isha, because you started in 2020, what was it like to try and build a community, especially knowing that anyone you talk to might report you for a minor infraction? Isha?
Well, it was definitely weird to always get the sense that you were always being watched or observed and everything. You could never really be alone and doing your own thing from that regime aspect of it. So you had to be very deliberate about what sorts of things you were saying to others. You couldn't have organic interactions. You had to ask questions like, oh, what did you do this weekend? Or things like that to really sort of determine if someone was cool or if they were a narc. And, that's just not the environment that students should be living in or can make friends in at all.
Did you find that it made it difficult to build a community when you first started here, Noah?
Yeah, definitely. That, and I didn't know what most of my classmates looked like because we were wearing masks outside and inside.
Oh, outside also?
Outside also. We couldn't eat in the dining halls either, so we had to eat outside and wear masks in between bites was the policy by Yale. So that also just took away a lot of the human connection. But yeah, like Isha said, asking these fishing questions, like it was kind of who can I break the rules with, right? That's how we kind of made our closest friends, which is a sad reality to live in.
So do you, Isha, Noah, and then we'll bring Trevor in a second, do you guys feel like you were able to build a community your freshman year? Noah?
Yeah, I guess broadly speaking, there is this silver lining of like there are a few people that I trauma bonded with that semester.
That's true.
But largely, like I haven't been able to really feel at home in a community until this semester and last semester when these policies have finally worn off. So they definitely prevented any meaningful personal connection, at least for me. And I don't doubt many others as well.
So, Trevor, you came in when they were sophomores a year, I guess, 2021, fall 2021. What was the Yale campus life like when you first stepped foot on it?
Yeah, so campus life was still segmented between kind of, I would say, those who were following a lot of the COVID guidelines. There were still gathering restrictions in place, masking indoors, and those who were not. For me, unfortunately, a lot of the times it seemed like it was almost a litmus test. I wasn't a big fan of a lot of Yale's policies. I may or may not have violated some of them. And so, people who disapproved of that, they couldn't be friends with me. They wouldn't want to be friends with me. And honestly, because of the reporting system, I wouldn't have wanted to be friends with them either because I would have been afraid of having to get hauled before the tribunal.
So how did you guys make friends, or at least try to find a community that you could connect with, notwithstanding all the COVID policies? Noah?
It was hard because there was a lot of unnecessary division that still, I think, persists to this day from Yale's COVID policy. So it was definitely difficult, but I'm starting to get the hang of it just now as a senior, which is also sad.
What did you do when you first got here to find that community, Trevor?
I was fortunate that none of my suite mates were particularly in favor of the COVID policies at Yale, so we were able to kind of hang out together and make other friends. Most of my friends, though, weren't in my residential college. They were in other groups that maybe they had an off-campus space, or we were able to, because we all kind of believed in not following certain regulations that we viewed as being irrational, we were able to hang out together without that kind of fear. Making friends almost, I would say, was like in and of itself so difficult because of COVID that it was almost like an act of resistance to Yale's COVID regime as we've been describing it, which is an interesting way to put it. But so
in 2020, as Yale was implementing a lot of these policies, Even then, we knew that the impact on people your age, people your classmates' age, excluding those who had comorbidities, other immune system deficiencies, was pretty minimal. The likelihood that you would have any serious complications was, next to nothing, pretty low. So, what did you think at the time, knowing that you guys weren't at risk really from COVID?
I think it sort of just really doubled down on the perception of Yale's response, right? That Yale wasn't really considering what was best for students who were not likely to suffer major consequences from COVID, but rather trying to maintain some sort of public image about they care about COVID, they care about public health, and impose a sense of morality that, if you're moral, you care about masking and stuff like that, and in ways that we probably shouldn't have had to care about. And the consequences we suffered, I think, as a student body, in terms of not being able to interact with people, having to wear masks all the time, be scared of one another, were substantially more damaging than anything we really ever could have suffered if we had gotten COVID, which many of us did either way.
Noah?
Yeah, I think it was just a big catering to a very small group of people who kind of were bullied into believing that COVID was this super serious thing that everybody needs to be extra careful to not spread this virus. God forbid that you get it, right? I think it just breeds this culture of weakness in Yale as a whole, especially within the student body, and that's something that you still see. And I also think that COVID was used as an excuse for people having mental health problems. I mean, people were adversely affected by COVID, don't get me wrong, but Yale just kind of used it as a cover-up. And if you don't want to come to class, that's okay. I know COVID is tough, but I mean, we're all in the same boat and we have to move forward somehow. So that was particularly frustrating.
So there was dialogue in the general public about how, if you were young and you wanted to go out and still have a good time, you were bringing that danger home. You'd kill your grandmother. And that was, used as an excuse to pressure people, socially or, legislatively, people who weren't at risk, such as people of your own age, to observe the same strict lockdowns as anyone who was heavily at risk. Did you feel that sense here at Yale as well, Trevor?
Yeah, definitely. I think that, Yale essentially was telling people implicitly through their policies and through all the emails that we got that if you don't follow these policies, if you don't follow these regulations, that basically there's blood on your hands because you are going to be responsible. You personally are going to be responsible for spreading COVID if you don't follow these regulations and rules. And that is incredibly damaging to people, to tell them that they are the cause of a pandemic, essentially. I think that Yale's policies created a mental health crisis amongst the students. I think the policies globally, or in the United States especially, created a mental health crisis, the likes which we haven't seen before. Because of those policies, Yale didn't have, as Isha said, the students' interests in mind. They had their own interests, their own image in mind. And so they decided to create these policies without thinking about the social cost, the mental health cost, or the academic cost of people actually being able to learn in a productive manner.
So, Isha, I want to kind of go to that broader culture, campus environment question. The kind of campus we're looking at today, how did those decisions, the decision to prioritize those who were afraid of COVID over those who wanted to experience college and could do so safely, how does that have long-term impacts that you still feel today?
Yeah, I think there's, like Noah was saying, this culture of weakness. I definitely agree with that. There's a sense that, especially if you're in the minority of something or something's just not going right for you, you're entitled to have everybody else sort of be responsible for that and be concerned about that to a very large, to a high extent. And that idea that, people cater to you, you don't have to change or you don't have to actually take active measures to be proactive if you do have a health issue or something like that.
So Noah, you were the first one to bring up the culture of weakness that came out of the COVID years. How do you see that manifest today on Yale's campus?
There are people who still I think the biggest impact that we've discussed is that there's like this mental health crisis now, and we've seen an uptick in the quote unquote need for increased like mental health resources following the fall of 2020. These things didn't really exist beforehand because they didn't have to. This is largely a created problem. I thus don't have much sympathy for it. People do have mental health problems, but the university is now catering to them in a way that they haven't before, in the form of recording lectures so students don't have to go to class if they're feeling, quote, anxious about COVID. And that's just not a thing. Like, most people hated the COVID policies, so it's just a larger Yale catering to a super small group of people, which is really frustrating.
So I want to take a step back and kind of look at how COVID has, I guess, divvied up the community and has, impacted your interactions with other people. On kind of a global level, just how you address COVID and how you interact with your friends. When you're talking to other people, do you feel it makes or is a part of the getting to know them process, figuring out how concerned they are about COVID?
I think to some extent it's become much less of an issue now. I think that in retrospect, most Yaleys don't think that the administration handled COVID well. And as Noah said, there is, of course, the vocal minority, but to be honest, I haven't really encountered many of them in my day-to-day life at Yale thus far.
Isha?
I think that concerns about COVID are still a pretty decent part of the dialogue at Yale today. Even though I think that we're well past the pandemic, people still use your public health ideas as a test for, or are you a good person? Are you a bad person? If you're feeling a little unwell, are you still testing for COVID? Are you quarantining for 14 days? Even though I think across the nation, most people don't do those things anymore. We sort of moved past it, but Yale and Yale students in particular don't seem to have really moved past it.
Think about your time here and how COVID has impacted. What made you most frustrated or angry about how Yale dealt with COVID? Noah?
I'd say the one-sidedness of everything was the most angering part. That COVID was emblematic. It signaled a transition of people largely believing that they're entitled to their opinions without you being entitled to yours, should it dissent from majority or minority opinion. And, that's something that the Buckley program is working hard to fight, but it's getting increasingly alarming.
I think the most frustrating part was Yale's inability to consider students' interests and faculty's interests. Yale is fundamentally a university whose priority should be education, and they seem to have divested so greatly from that, and that was really frustrating because I came to Yale expecting my education to be the top priority and the education of my fellow students, and that was never a priority for Yale.
I found Yale's vaccination policy to be incredibly infuriating. I still do, because there isn't one anymore. You don't have to be vaccinated at Yale anymore if you come to campus. But, 6 to 10 months ago, you did. And so there's this kind of, Yale was, encouraging students very aggressively to be vaccinated. I mean, it was required. It was a process if you wanted to get an exemption. I didn't end up getting an exemption for the vaccine. Because Yale was essentially creating two castes of students. The one caste was the unvaccinated, and the higher caste was the vaccinated. And if you weren't vaccinated, you weren't able to go to sports events. You weren't able to do certain things. You had to test more. Your life was made miserable explicitly because you didn't want to get the vaccine.
Thank you all for your comments. Thank you for joining me. I really appreciate having you on Pod and Man at Yale.
Thanks for having us.
Thanks, Ari.
Thanks.
Now, with that, let's get right to our interview with Dr. Scott Atlas, who spoke at Yale on September 21st. Check it out on our YouTube channel. I'm pleased to be joined by Dr. Scott Atlas this week, who joined us along with Stanford professor Jay Bhattacharya on September 21st for a panel on COVID lessons. Check it out on our website or our YouTube channel. Dr. Scott Atlas is the Robert Wesson Senior Fellow in Health Policy at the Hoover Institution. Dr. Atlas investigates the role of government and the private sector in healthcare quality and access, global trends in healthcare innovation, and the key economic and civil liberty issues related to health policy. He has been a senior advisor for health policy to a number of candidates for President of the United States and advised several members of Congress. He served the nation from August to December 2020 as a special advisor to the president and as a member of the White House Coronavirus Task Force. He's also the author of several books, including his most recent, A Plague Upon Our House, My Fight at the Trump White House to Stop COVID from Destroying America. Thanks for joining us.
Happy to be here.
You were a prominent voice in the COVID policy debates, and you were censored despite your direct influence over the actual policy outcomes and policy decisions being made. What were the most egregious cases of censorship you faced regarding COVID and COVID policy?
I think the most important censorship episodes were when I became advisor to the president, which was really essentially July 31st of 2020 for the next 4 months, when the decisions were being made to close schools, particularly as part of these broad lockdowns and other draconian measures and mandates. And that importance is because the American people need to hear what the advisor to the president is saying. And what happened, I mean, this is obvious. It shouldn't even have to be articulated that way. But I had been speaking out, writing, doing interviews since March 2020 on ending the lockdowns because they were both destructive to low-risk people, especially low-income families and our children. And those lockdowns were not protecting the people at risk to die. And so people were dying, particularly even in nursing homes, the obvious high-risk group. So I was writing and speaking quite a bit during the spring and summer of 2020 on this. And the censorship began when I was in the Trump White House, when YouTube took down an interview that had been up already for several months that I did in the spring on the low risk to healthy children. They took it down, they deleted it, and Twitter blocked my account and deleted my tweet, suspended my account for posting the actual data on masks in August of 2020. Those were the overt social media censorships, which I think were extremely harmful because we're a society founded on freedom of speech and freedom of information. B, people need to hear facts to decide what's correct. And if the arguments about masks being effective or lockdowns and school closures being appropriate, if their arguments were clear and justified what they were doing, they wouldn't need to censor opposing views.
Right.
So, I mean, this is all obvious. The other form of censorship that I think is important and gets ignored is that censorship is not always just overt blockage of speech or blockage of written information. It's also cancellation, what we've known now as cancel culture for the last few years. And this is a form of censorship because what happened to me, but also to others, was, for instance, in my case, Stanford University Medical Center, some of the faculty there sent around a note in public and internally that was a completely defamatory set of lies and distortions about what I said. They had no facts to counter what I said because everything I said was 100% correct. All they did was claim that I was dangerous, and they did this publicly too. And now the effect of that sort of character assassination is to they try to censor me, of course, which doesn't work because it's too important. People are dying. And I'm just not going to let that kind of thing happen. But what that does successfully do is create an atmosphere where others self-censor. Others are afraid to step forward. And again, as I've said many times, I got hundreds of emails from medical scientists and doctors and other people all over the country, hundreds, saying, keep speaking, you're saying exactly what's true, we agree with you, but we are afraid to step forward.
So the reason I wanted to start there with the worst cases of censorship, the worst examples, is because a lot of people look back at COVID and say, oh, it was a fog of war situation, that's why we did these things, people made mistakes, and there have been calls for, an amnesty for these kind of like censorship or an egregious censorship instances. What do you say to people who make that claim and ask for kind of a mea culpa, move on from the censorship you experienced?
Absolutely not. We cannot do that. And there are several reasons. First of all, I'll address their claim, the quote, "we didn't know" excuse. And we hear this all over the place, including from people like Governor Gavin Newsom of California. He said it recently, "we didn't know. We made mistakes only because we didn't know." No, that's false. That's a lie, in fact. And if it's not a lie and they actually believe that, they're disqualifying themselves as a member of a group of rational, knowledgeable people. Because in spring of 2020, all of the following things were known to be false, which is what they claimed to be true. They were known to be false. It was known to be false that the virus has several orders of magnitude higher risk of death than influenza, that children are equally at risk, that everyone spreads equally, that no immunity is present other than through a vaccine, that masks work to protect the wearer and to prevent the spread, that lockdowns stop or eliminate the virus. All of these things were known to be false. They were contrary to basic biology, to pandemic standard management knowledge, and to the evidence on this specific virus. Those things were false. We did know. That's point number one. Point number two is why not just say, okay, maybe they didn't know, we made mistakes, let's move on. The reason we can't do that is because, first of all, we are an ethical society. An ethical free society is based on truth, objective data. We cannot ignore that. Especially after all of what Americans have been through, particularly, again, minorities, poor families, children, they were destroyed. And this was a shift of burden, make no mistake about it, from the affluent to the poor, because the affluent can generally get their kids into some kind of a little micro school in their neighborhood where everybody has a PhD or an MD. They can order in all their stuff through Amazon. They can get their groceries delivered by the low-income, quote, essential workers, unquote, that were being exposed to the virus while they were sequestered in their homes, et cetera. So that's really unethical, immoral, and frankly, sinful. Secondly, though, we cannot just excuse things because people like Anthony Fauci, Deborah Birx, Redfield, and others who led the CDC, and the governors, they presided over the biggest, most lethal healthcare fiasco in modern history. That must be talked about in detail so that we don't ever let that happen again. And while they will never apologize, because it takes integrity to admit you're wrong, and these people have no integrity, frankly, we need to demand the public admission and accountability. Whether we get the accountability or not, we need to air it publicly because we need to make everyone aware so that we never let this happen again.
So I want to drill down on something you said, because we focus a lot on free speech and censorship on campus. I think in the second part of your answer, you talked about how the kind of way the debate was controlled actually resulted in deaths, right? Deaths of despair through economic deprivation, poverty. So can you expand a little bit more on that? What were the actual human consequences of the fact that only one side of the debate was represented?
Sure. I mean, there were a long list of things that were done as a result. Okay, I'll give you an example. They did this to convince people that they did this propaganda, this campaign, and these grossly erroneous policies that were, again, denying simple data, biology, and even common sense to do the lockdowns. And that caused a drastic list of consequences. Number one, about 650,000 people have cancer in the United States on chemotherapy. Half of them didn't go in to get their chemotherapy. They were afraid to be in a medical facility. Okay. Almost 300,000 cases of child abuse in the United States in the spring of 2020 alone, from those 2 months of school closures. almost 300,000 child abuse cases went unreported because schools are the number one institution where child abuse is noticed. The child abuse didn't disappear. In fact, there's documented evidence it got worse because there was an abrupt rise in severe child abuse going to the emergency rooms during the spring because of the school closures. There's a massive increase in spousal abuse when people lost their jobs in the lockdowns. This is documented, and particularly in low-income families. We had 2/3 of cancer screenings went undone. And what does that do? It doesn't just delay the diagnosis. The delay in diagnosis causes a later stage of cancer when it's picked up. The cancers still occur. So the spread is more prominent. The distant, metastatic disease is more frequent, more pain, more suffering, and more death. You had we had 40 to 50% of acute stroke patients and acute heart attack patients not call the ambulance. They were afraid to go into a hospital. Because remember, the hospitals were both shut down. Many medical facilities were shut down, but also they introduced a fear of going into a medical facility because there were COVID patients there. You had, there were so many things that happened, like the 85% of living organ transplants were not conducted compared to the previous year. Okay, the people needed an organ transplant or they were going to die. 85% of them did not get done because people were afraid.
So moving off of that, you mentioned in your event here that when you and your co-panelist Jay Bhattacharya started, speaking up about the COVID issues, you were kind of idealists about it. You had an optimistic look. We could have a fair, good faith discussion. A lot of the students here at Yale, whether they're conservative or just centrist and don't follow campus orthodoxy, also make that calculation, and often they come into a discussion, share their perspective once, realize only a subset of opinions are allowed, and decide, maybe it's not worth it. What advice would you have for, Yale students on other campuses who have different perspectives, would like to share them, or maybe are a little reticent about it?
Sure. I think this is very important. How do you go about speaking out when you disagree with the orthodoxy? And there's a tremendous amount of pressure. I don't minimize the pressure, particularly, I think, for young people who depend on their social network, rightfully so. And, believe it or not, I was young once. We have to take that into account. So how do you go about it? Number one, you try to find like-minded people. I think you have to realize you're not alone. And this is the second point. It's good to speak out, find like-minded people on campus or in your social groups, and remember that a lot of people actually agree with you. But secondly, when you speak out, you empower your other friends and classmates and social circle, because a lot of people, they don't want to go first. And believe me, I know how hard it is to go first. But when you speak, there are people waiting for someone else to say it.
What are the kinds of policies you think university leaders should be implementing and supporting and enforcing if they're really going to ensure campus has a good free speech climate?
They need to support diversity of views. I'll give you an example. On my own campus of Stanford University, there's a de facto Stanford student newspaper, and it's extreme. It's extreme, one-sided. Writes all this very immature vitriol. It's an embarrassment, frankly, and I'd be embarrassed for the students' parents who write that kind of stuff. But it's sad that the university does not support equally the alternative conservative newspaper on campus called the Stanford Review. The Stanford Review is filled with brave, courageous students who speak against what is the narrative. And, just like the Buckley Institute at Yale, these kinds of organizations need to be supported, not ignored or even criticized. You want to encourage disparate views. You also need to clamp down on the cancel culture that is pervasive on campuses. You cannot have a society filled with or led by people who are not tolerant of views being expressed that they simply don't agree with.
Well, thank you so much, Dr. Atlas, for joining us. We really appreciate your time. Wonderful interview.
Thank you for having me.
That's another episode of Pod and Man at Yale in the bag. Hit the subscribe button if you haven't already. And always remember, for God, for country, for Yale, in that order.